morning and welcome back. Well, the La Crosse area is at the forefront of changing the face of mental illness. Here to talk about teens and depression this morning, Gunderson Health System behavioral health therapist Sarah Johnson. Sarah, thanks for waking up with us this morning.
Thanks for having me.
Now, we've seen the statistics, suicide, one of the leading causes of death in people ages 15 to 24 years old. Do we have any idea what the scope of the problem is here in the Coulee region?
Consistent with national numbers, certainly. Like you said, depression is really common, which is why I'm glad that you mentioned that it's preventable. That's really the important part of the message here.
Do we have any sort of idea what leads to it, what sort of causes depression?
Sure, there's all kinds of factors that can lead to it. Sometimes it's biology, sometimes it's things that are going on in a person's life. Usually it's a combination of the two.
What are some of the signs and symptoms people can look for in identifying depression in young adults?
Consistent with what we're seeing with adults, recently La Crosse was a part of the national launching of the campaign to change direction, and what they unfolded are 5 signs to look for, and that would be personality change, agitation, so moodiness, anxiety or irritability, that kind of thing, withdrawal, poor self-care, and hopelessness. So those are some of the 5 trademarks that you might be seeing in someone, a young adult or an adult who has some depression going on.
I'm glad you mentioned the campaign to change direction because the message of that is that this is something that can be difficult to talk about, but how do you start that conversation? If you notice somebody who may be suffering from one of these signs, how do you bring it up with either them or a medical health professional?
Well, if it's your teen, I think having conversations with your teen regularly about how they're doing, how their life is, what's going on, is a really great foundation for that. So doing that regularly and kind of destigmatizing, normalizing those conversations about how's your head, how's your stress level, those kinds of things. But if you're noticing some of those signs in your teen, I think it's absolutely okay to say, hey, I'm noticing these things. How are you doing? I'd like to talk with you about that.
Yes, and there is help out there if you need to start that difficult conversation as well. And Sarah, thanks for waking up with us this morning and shedding a little light on the issue of depression.